Hi girls, we are bringing a special edition today to you of WiP Healthcare. I just wanted to say a little forward before I introduce today Dr. Guneet Chopra to you. In the last 1 year, COVID-19 has claimed millions of lives around the world and changed the way we live and we navigate our lives. Currently in India, with the kind of surge of numbers, which has crossed over 2 lakhs, there is so much of information going around and so much of panic and fear regarding the disease. I thought it's a good time that we call an expert and hear her views directly. Dr. Guneet Chopra has more than 15 years of clinical experience and is hugely familiar with the diagnosis and treatment of multiple diseases, disease states, and health concerns. She has done her fellowship in diabetes and postgraduate diploma in medical genetics. She has been at the forefront of fighting pandemic. I thought it would be a good idea for her to come and inform our members what's been happening. Welcome, Dr. Chopra.
Thank you, Mandeep. That was really sweet of you. I'm always there. Yeah.
Okay, so I'm going to start asking you that how is the second wave different from the first?
To be honest, I would say there is no difference as such. It's more that the people had become more complacent and more lax with the things. And that's why it's hitting us more because, being under a lockdown for a year had a crazy impact on everybody, be it financially or, your work front or any which ways or your health front, because I saw so many anxiety patients over the period. So if we think about it, it's basically, I would say there's not much of a difference. If we see the parameters, the numbers which are coming down, it is as similar as what the first wave had. It's just that this second wave, the transmission is much faster. That's what we are noticing. Though the symptoms are not that severe as what we saw in the first wave, because we were not prepared probably. Now we're more prepared, but people have become more lax. That is one thing which we need to take care of. So that is the only thing that I feel is a difference out here. But at the same time, saying that the age group, maybe 0 to 9 or 0 to 10, are also showing positive cases now with the second wave, which earlier we were not seeing. And but at the same time, having said that, I would say this age group again are asymptomatic as what it was earlier. They don't show much symptoms. Most of the children, they've been immunized, so that's one reason why we are not very worried about that age group showing the symptoms. But the age group, say around about 20 to 40 or 45, are showing a lot of symptoms, and directly they're showing breathlessness this time, which we did not see in the first wave. First wave was a little slow probably for the symptoms to come out, but this time it is a little faster because the spread is faster. So what is the difference that majorly I see is, like last time, if I had a patient from one house, probably there was 1 or 2 people who were infected in the same house. But this time in the second wave, it's mostly the whole household getting infected. Or if it's a workplace, the whole workplace getting affected with one patient who's showing the symptoms. So the spread is very, very fast. So we have to be very careful. We have to be more agile. We have to follow all the rules as we were doing last time, which we've stopped doing it, I would say. So they were the basic 3 rules, which we were doing earlier as well, that we
Are there
need to
any
do.
new symptoms as well? Because the earlier time it was just fever and cough, and now people are talking about many others like diarrhea and the neck pains and
Uh,
stuff.
to be honest, Mandeep, diarrhea was there earlier also, but people were relating it with the antibiotics probably. They were saying the diarrhea is happening because they're taking antibiotics as a prophylactic measure. But there was diarrhea then as well. So it's not a new symptom, no new symptoms as such. It's just that the symptoms are little, probably breathlessness is more in these patients now, which were not there earlier. And diarrhea has been there, loss of smell, loss of taste. But at the same time, there are a lot of asymptomatic patients as well. So, the symptoms are almost the same as what it used to be earlier, I would say.
Okay. In what instances do you recommend that a person go and get a RT-PCR test done, or see the doctor, or go into a check into a hospital? These are a lot of confusion regarding things like that.
Yeah. So, what I generally advise my patients is you have to wait and watch for at least 3 to 5 days, because 5 days is the period when you start seeing the proper symptoms coming in. Day 1 or day 2, the RT-PCR might not show or pick up. the study, the genes won't show. So you get it done and you feel, oh, you're negative. So you just take it coolly and you just leave it. But after 5 days, it's very, very specific that you get it in the RT-PCR and you come to know the actual results, which we can generally miss maybe if we do it too early. So we should at least wait for 3 to 5 days after the symptoms start coming in. And the symptoms, as in, having a lot of lethargy, headache, loss of smell, loss of taste. These are the basic things that we see. But there are some patients who come only with some, difficulty in digestion, as you said rightly, diarrhea. So they come up only with diarrhea, mild fever, and sometimes the fever spikes also. So it's very varied in various patients. So it's not just one symptom in everybody. That's what we see.
Telling people who have COVID, we anyway tell them to self-quarantine or isolate themselves. But those who have children at home and elderly people at home, is there any special recommendations that you give it to such people?
Yes, especially if you have elderly people, they're still the more vulnerable one right now again in the second wave as well. So it's not that the elderly are not vulnerable anymore. They're very much vulnerable, and the people, especially with comorbidities, are more prone for it. So we have to be very, very careful about it. And this is the time when, some young people are having it, they have to quarantine themselves, not to be in touch with those people, and put themselves in one room so that the rest of the people can be saved. But said that, as I told you, the second wave, the transmission is more faster.
So this entire research about it being airborne and things, is there any truth in that?
Partly, I would say yes, but not totally, because now as the research is coming up, we are finding new things. They're saying it's not airborne anymore. But no, it is. It is very much there. And till we get the herd immunity, we have to be very careful about the social norms and have to follow all those basic 3 points that we were going on with the mask, hand washing, sanitizers, and social distancing. This is the main things that we have to take care of. And that is only going to keep us moving in this difficult time.
This is also the time that you have good doctors and a lot of other people, I would not say quacks, but people saying that eat this and eat that, and then it will save you from the the people are always talking about what supplements to eat, what exercises to do. Generally, there are a lot of YouTube videos and everything going around.
I agree.
As a doctor, what do you usually prescribe to your patients?
I'm very happy, Mandeep, you brought it up because, over this last 1 year, as you rightly said, people have been following all kind of YouTube videos and, WhatsApp messages, forwards about taking kadas, taking supplements over the shelf. And they've been taking it, for maybe a year now. And I have had so many patients with toxicity because of, taking the supplements too much. See, too much and excess of anything is always bad, as we always say. So probably we have to do it in moderation. Maybe we take it for a month or maybe take it for 2 months, give it a break, and then take it back again. See, supplements like zinc, vitamin D, calcium, these are all very good for your immunity. They boost up your immunity, but you have to take it in moderation. You cannot go overboard with it. So what you need to do is take it for some times. Maybe you take it for 20 days or 25 days, give it a break of a week or 10 days, then start back again. So it's not that if you keep popping the medicines, it's going to help you in your immunity and you won't get the virus. That's not the story.
But do you recommend that people who are, because of lockdown, can't go out, at least follow a process of doing some exercises and things at home?
Definitely. Definitely. Yeah. See, exercise is the main thing because it increases your circulation, it increases your oxygen levels. So these are the things that we see during COVID is hampering, your lungs, your breathing, your everything. And if you're walking around, if you're active, if you're, energetic, all these things will be at the bay. You might get COVID, but you will be able to fight with it better if you're healthy and you're energetic and you're doing the things day-to-day basis. If you just start doing it one odd day, it's not going to be the same.
Yes. Doctor, the last question before we go, one is on the vaccinations. Yes, that has started, but there is a whole country which is younger, less than 45, which is still waiting from 1st of May to start getting that. But there is, I'm told, I don't think that within our members there'll be people who haven't got it, but there are a lot of people who are talking about hesitancy in getting the vaccine done and which vaccine to choose. What is your recommendation?
See, I think all vaccines which are available are good enough, whether be it Covishield or Covaxin, whichever is available in India, we should go for it. We should not wait for anything else to come down. Earlier, the better is always better. Because I've been seeing my patients who've been vaccinated, they show less symptoms, the severity is less, but I would not say they are saved from COVID. See, none of the vaccines save you from the disease. It's only probably the intensity of the disease is not as much as what it would be if you're not vaccinated. So whenever you get a chance, whenever possible, please get yourself vaccinated. It is very, very important and it is the need of the hour. We should not avoid it. We should not read too much about the things also. All of the doctors, most of the frontliners have vaccinated themselves. We all are doing well. I have taken my vaccine. I'm doing fine. So I would say thumbs up to the vaccines. You should be taking it as early as possible. But once again, I would like to say the patients who have been COVID positive, they need to at least wait for 3 months and then take the vaccine once they've turned positive. Because there's no point of taking the vaccine immediately after recovery of COVID. That is one thing that they have to make a note. It's not that they've had the infection and they won't have it again. They might have again, but they have to wait for some time because there are still antibodies in their body. So no point of taking the vaccine immediately. But you have to take it.
Any final message?
The only thing I'll say again is like we have to follow those 3 steps as I've been saying again and again. Wear masks, people. Please cover yourself properly. Don't wear a half a mask. Cover your nose, cover your mouth. Wash your hands. Don't touch around things outside. Come back, take a bath. Try to keep the elderly at a safer pace. And I would say social distancing. No parties for some time. Please, people, avoid it as much as possible.
Thank you so much, Dr. Chopra, and all the very best. I think you need to take care as well. You've been there in the front line, and thank you so much on behalf of all our members that you are there every day fighting for this. Thank you so much. Bye-bye.
Thank you, Mandeep. My pleasure. Bye-bye.